Good morning or good afternoon to everyone, depending on where you are joining us from. Welcome back to N4's first ever professional development series on trauma-informed care. This is session 2, trauma-informed care and its application to staff. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah. I use the pronouns she and her, and I'm a project coordinator on the N4 team. And I'll be introducing our facilitators today. And our co-host, Andrew Tomeyer, is N4's education coordinator, and Andrew will be monitoring the chat box today. And if you experience any technical difficulties today, please feel free to send a chat message or an email to Andrew or I, and we will try our best to support you. And also facilitating the breakout rooms later today will be Kat Goodfellow, N4's research coordinator, and Colleen Drake, the N4 project coordinator. And I'm really pleased to be welcoming back our facilitators for today. So we have Holly Murphy, who is the advanced practice leader at the IWK Health Centre, Laura Callaghan, who is the nurse practitioner in pediatrics at IWK Health Centre, and Prasanna Kariyawansa, who is the program educator with the Trauma-Informed Care team. So welcome back. Thanks so much for coming back and providing a second session. And we will be recording the event today and uploading it to the e-learning side of our N4 platform. We will share this with you as soon as it becomes available. However, to ensure a safe space for discussion and dialogue, we will not be recording the breakout rooms today. So you will be notified when the recording stops and when it starts again when you join back into the main room. And today we'll begin just a few housekeeping items. Please keep yourself on mute, unmute yourself if you want to ask any questions or when you're participating in the breakout rooms. Please use the raise hand feature to ask a question or to make a comment, or you can put your questions in the chat box. And while we encourage you to turn on your video, it is optional. Do whatever's best for you. And we will begin today with a short didactic from Laura and Prasanna from the IWK Health Centre. And then Holly will be introducing a breakout room activity. And while Holly does this, Andrew will put the handouts that will be referenced in the chat for you. And then we'll come back as a group for a wrap-up period and a question and answer period. And we'll close with some closing remarks around 2:30 Eastern time. So with that said, I'm going to pass it over to our facilitators today.
Great, I'm just going to share my screen, so just one second. Just one second here. Here we go. All right, I got on the right one here. Oh, wants to skip that screen, but that's okay. I'll just start. I wanted to start as well with just welcoming everybody to the webinar. So this is our second discussion around trauma-informed care. And I do want to first begin with a land acknowledgement specific to Nova Scotia, where we are located. So Halifax is located in Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. So this territory is covered by our treaties of peace and friendship, which the Mi'kmaq and the Passamaquoddy peoples first signed with the British Crown in 1726. So today, all Nova Scotians, both Mi'kmaq and non-Mi'kmaq, agree to keep this promise and continue living in peace and friendship together on these lands that we share. So as we prepare to move into this presentation, I think we just want you to feel free to get comfortable and consider and reflect about the things that you might need to feel comfortable as well. We recognize that the topic of trauma can elicit many different types of responses and reactions, and that the content might impact people in different ways. So feel free to do what you need to do to be comfortable. If you want to leave your camera on, that's great, or if you'd like to turn it off, that's fine as well. If you need to take a break, please give yourself that permission and ask questions or put them in the chat. As they come up for you. So be aware of the sports that you have around you today, whether you are kind of joining us from work and your workspace or whether from home, supports that you might have from your colleagues or your family, as well as supports that might be available through your organization, such as EAP or other supports. So the objectives today, we're going to focus on trauma-informed care as it can be applied to personal experiences amongst professional caregivers. So caring for the caregiver is a focus as we talk about key principles and explore different trauma-informed approaches that can support staff wellness. So as we look and just want to review for a few minutes and very briefly some of the things that we covered in our first presentation. So so that we have a shared understanding of trauma that can guide our discussion today. So what is trauma? You can see from the definition on the slide that the concept of trauma is quite broad. We identify it as anything that results from experiences that can overwhelm an individual's capacity to cope. So this could be an event that's happening at a personal level, societal, or a cultural level. Trauma could be an historical or a current event, and some examples of trauma could be war, disasters, neglect, exposure to violence, lack of access to social determinants of health, or systemic racism. So what is trauma-informed care then? So trauma-informed care is an approach that can be applied at all levels, at the personal, interpersonal, and organizational level. As we consider the broad definition of trauma, it is an approach that recognizes that many people and systems have experienced trauma, and there needs to be a caution in providing care in such a way that appreciates the presence, the impact, and the different responses people have to trauma. We consider applying trauma-informed care kind of as a universal precaution approach, so it's applied to all people we interact with. And trauma-informed care is guided by principles of trust, care, choice, collaboration, and empowerment. So I think an important consideration here is that what is different from other models of care, maybe with respect to the trauma-informed care approach, is that this approach is equally applied to the populations that we serve, so the clients we see, interact, and collaborate and care for, as well as applied to organizations and the people that work within systems. So not only do we want to support and optimize the client experience by the principles of trauma-informed care, but we want and need to apply these principles to systems that impact and support an engaged workforce. So for an example, at the hospital or the organization I work for, the IWK, we have committees that would focus specifically on patient experiences and feedback, but also we have committees that would really focus on workplace safety. So trauma-informed staff, we look at in our last session, trauma-informed care approaches as it applies to clients. And today we really want to focus on trauma-informed staff. So trauma-informed care as it can be applied to staff and professionals working in systems and organizations. I think there's a recognition that staff will be hard-pressed to deliver and create trauma-informed spaces and experiences for clients and families if they do not have a workplace that also embraces the same principles of safety, trust, choice, collaboration, and empowerment for staff. Robert Wicks, the author of The Resilient Clinician, writes, "The question is not whether stress will appear and take a toll on those working as clinicians and non-clinicians. Instead, it is to what extent professionals take the essential steps to limit and learn from this very stress, to continue and even deepen their personal lives and roles as helpers and healers. So it is not a matter of the if," Wicks writes, "but a matter of the when." So we all know in various systems, whether healthcare, justice, education, settlement, social services, there will be stress for care and service providers. But when the stress occurs, what measures are considered to identify the stressor and to put in place responses that will not wear down but strengthen and support the person? Remember that our bodies respond to stress. So there are some pretty significant physical and psychological impacts that stress brings with it. So, trauma informed staff will seek ways to not just reduce stressors on systems, on organizational levels, but also look to ways to mitigate the negative effects of stress as it shows up in our workplace and in our work life. So, in addition to understanding about trauma, is the concept of the different types of stress. So we talked about this in our last presentation, so I'll go over this really briefly, but not all stress is created equal, and there's different types of stressors which can impact both physical and emotional responses. So eustress, as we can see, is a positive stress, and it's very short term, and the body often responds with an activation of the sympathetic nervous system, and we have hormones and responses such as increased heart rate and other physiological things that happen to allow a person to deal with the stressor. Tolerable stressors are often larger stressors, but are time limited and are often buffered by positive and social relationships to help mitigate and kind of help a person work through those stressors. But toxic stressors are continuing stressors. So, stressors like neglect, repeated exposures to violence, or not having basic needs for living. These stressors create a prolonged activation of the stress response system, and they're often in the absence of supportive relationships and buffers. And this can lead to long term brain and organ system damage and can likely lead to stress related illnesses. So, as we think about the types of stress in context in our discussion today on trauma informed care applied to caregivers, think of different workplace stressors maybe that you would pay attention to or you might have noticed. So, a minor stress could be maybe getting to work late or showing up late for work where it's temporary. It kind of gets your heart pumping, you feel pretty stressed out, but the stress is soon relieved and the stress is over. Tolerable stress might be maybe working short staffed on a unit for kind of a semi-permanent basis, and or it could be having a conflict in the workplace with a particular colleague that you see, and this can cause stress, definitely, on kind of a tolerable ongoing level. Toxic stress might be experiencing violence in the workplace or ongoing tensions in the workplace. And if a person is experiencing these types of stressors without supportive and caring relationships, then this kind of toxic stress can have long lasting impacts. I think, too, of some of the workplaces, I think mostly in healthcare contexts, but that are vulnerable and facing high frequency of stressful events. So I think of ERs, mobile crisis units, the operating room, ICUs, and mental health, just to name a few of the spaces that might see more high frequency stress events. And in different sectors, whether it's healthcare, justice, settlement, or social services, I'm sure we all have identifiable workspaces that are particularly vulnerable to these high stress events. As we think about stressors professionally, professionals might face, I think, also thinking about, what stresses might people face in the context of providing care to newcomers or working in the settlement sector. So a few things come to mind. So a stress might be just, the language barriers that are in place and the addition of needing to find extra resources to be able to communicate effectively. So planning for a simple meeting or just wanting to give brief feedback can actually take a lot of resources, a lot of negotiation to find those resources and time and energy. Certain sectors may not have access to interpretation, so this creates added stress and can definitely impact the positive interaction between the provider and the recipient of care. Other stressors, that I thought about was just lack of resources to support your practice. So often the tools that we might use in our practices or the resources that would typically be available may not be available in different languages or different translations. I think just recently I'm trying to put together an exposure ladder, like so part of CBT kind of treatment or therapy, and not being able to find something like that in Mandarin. And so having to think about how do I do this work when I typically would use a handout. So that creates a bit of stress. The stress of seeing constant barriers and constant gaps and difficulties in accessing care, I think that creates stress within health professionals. The stress of navigating and advocating for clients in rigid systems, the weight of feeling like the client's voice. So I think, speaking and advocating for and with clients who we know just may not be heard because of language barriers or because of power imbalances or just a lack of knowledge to navigate or a lack of power within systems. So that can cause ongoing stress, feeling that you are the voice of the client, even despite all the ways that we try to empower clients as well. The stress of being the only person attached. So sometimes there are difficulties in finding ways to be able to transfer patients or clients into different opportunities or different services. It's difficult to refer sometimes because other services may not have capacity, may not have room, or may not have the resources needed. And so you can be in a position where you're the only care or the only support that's attached, and that can come with a degree of stress. And I think, certainly not last but certainly not least, the impact of vicarious trauma. So hearing difficult stories that people share of their experience and how some of the experiences before landing in Canada and some of their experiences as they are in Canada and as they move through the process of acculturation. So we want to look at a few different kind of concepts as we move forward talking about trauma-informed care applied to professionals. So the first concept just to talk about is psychological safety. So a principle of trauma-informed care we know is safety. And safety is not just about physical safety, but also about psychological safety. Workplaces where there is psychological safety allows for mistakes, questions, risks. It allows the worker to identify problems and to disagree and to be able to express themselves as an individual, not just part of a team. So when you have psychological safety in the workplace, people feel comfortable being themselves. They bring their full selves to work and feel okay laying themselves on the line. That was a quote by David Altman. And I liked that idea of bringing your full self to work and feeling really comfortable to be yourself in your workplace. Dr. Edmondson notes that psychological safety isn't just about being nice, but it's about being free to give feedback, to admit mistakes, and to learn from others. Psychological safety is fostered by organizations and the approaches that they take. I think, for an example, where I work, we have what's called a SIMS or a safety and improvement management system, where errors or near miss mistakes are captured. In this system, there's an emphasis on learning from the errors and improving our strategies to support safety, rather than a focus on the person who erred or on punitive measures that might need to happen. So organizations can adopt policies and support and promote positive and psychologically safe workplaces, such as respect for workplace trainings or guides. But beyond the organizational approaches, I think is the personal responsibility that everybody has to contribute to a psychologically safe workspace. So it's a personal responsibility to ensure that your attitudes and actions promote safety. So are you somebody who is able to promote an inclusive workplace? Are you willing to reflect on your attitudes towards others who are learners or towards others who may make mistakes? Are you able to acknowledge the mistakes that you have made? Are you open to others' questions and able to identify concerns and problems? And are you aware of subtle, perhaps even unintentional harms that can be caused by microaggressions in the workplace? So, to talk about psychological safety as it applies to many who work with newcomers, psychologically safe workplaces, I think, involve feeling safe to ask questions about the care of newcomers and to identify inequities in the system and to actually disagree. I was on a recent Zoom call with other colleagues who work in the settlement sector, and it was noted that there's a risk and maybe a fear of being pushed out by organizations when a person starts to address and identify inequities in systems. So I think there's a lot of room, I believe, both on the personal and on the systems level to improve psychological safety within our workplaces. So the next concept we want to look at is that of vicarious or indirect trauma. The American Counseling Association would identify vicarious trauma as the emotional residue of exposure that counselors have or for other people have from working with people as they are hearing the trauma stories and become witness to the pain, fear, and terror that trauma survivors have endured. Matthew's definition talks about a profound shift of worldview that is experienced. I like the word description of the emotional residue. In the moment we engage, provide care, react, respond as we have been trained to do. I think of work in emergency or in other areas of crisis where you need to show up and respond to what's happening. But even after you leave the encounter, there can be a sense of the impact that stays with you. As you think of this over time and the cumulative stories and interfaces with others' trauma, it can lead to distress, which can show up in different ways or impact you in different times. In my own life, I remember returning from work where I was working in a very impoverished area and I had many patients who faced loss of life due to extreme poverty and extreme hunger and illness. Often the kids that I worked with didn't have access to basic necessities such as clothing or shoes. And I remember returning home and, it not really striking me until I was at the back of the Walmart in the shoe aisle. And then I just started sobbing because my only thought was, why are there so many shoes here? So it can show up in different times in your life. And I think it's important to recognize the impact of vicarious trauma. I'm sure, you can reflect perhaps the stories of trauma that maybe you have heard or you've been aware of, and even just being mindful of things that we might see on the TV, things that might be in newspapers, especially, related to newcomers. I mean, recently there was less than a week ago an article about 31 people that sunk upon a vessel that was trying to move to a different country. And so those stories can impact people kind of and bring effects related to vicarious or indirect trauma. Some of the impacts of indirect trauma can just be behavioral changes, cognitive changes, so inability to pay attention and focus and concentrate. Behaviors can change like increased drinking or substance use, difficulties in falling asleep, persistent feelings of grief, sadness, loss, isolation, and, spiritual symptoms such as feeling hopeless or feeling a loss of purpose. So the symptoms can look very different for different people and can show up in different times, but it's important to be aware of the impact of vicarious or indirect trauma, especially in work where we might be in front of those trauma stories a lot of the time. So the next concept is compassion fatigue, and this is different than vicarious trauma in that compassion fatigue is an erosion that takes place gradually and over time and reduces a person's ability to refuel and regenerate. It affects your ability to empathize with patients and clients and loved ones. So fatigue can make a person feel indifferent to the suffering of others due to the frequency of engaging in compassionate work. And I think what is kind of ironic maybe or interesting with regards to compassion fatigue is it's often affecting people in the compassionate work. So that would make me think that people that are in that work are quite compassionate by nature to be in that work. And yet you can find yourself actually feeling really, unempathetic and maybe very different from what your natural tendency would be. Um, I can think of, an example that I thought of quite readily was my first job in nursing was in kind of inner city Toronto, an emergency and trauma center. And, after a few years of that work, kind of facing with all sorts of patients with urgent and emergent needs and trauma, I found myself kind of being less patient or less empathetic in my responses. And I noticed that this would show up at home. I was, newly married at that time, and I think my husband had a cold or a flu, and he was looking for some TLC. And I remember my first thought was, "There's nothing wrong with you. Your limbs are still attached. Stop bothering me. Like, I'm not going to give you anything." And I remember actually being shocked by that thought and that response, because that was not who I was. And I was just reflective that all, like, my natural empathetic responses, especially to my, family member, were quite blunted, and it actually kind of made me more self-aware. So I don't know if you have similar examples, but I have learned to be a little bit more empathetic um, when my family members are sick. But it did kind of help me to understand a little bit more about compassion fatigue. All right. And as we keep moving on, just a little bit about moral distress. So, moral distress is another factor that can impact a person's psychological well being in the workplace and in the work that they engage with. So, moral distress stems from feeling uncomfortable or upset when what we perceive as the morally right action is not able to happen due to a systems or an institutional barrier. Another way to describe moral distress would be the emotions that arise when we're faced with a situation where we feel that the ethically correct action is different than what is able to occur or what you might have been tasked to do. Um, Again, I can think of lots of examples of moral distress that shows up in healthcare systems and other systems. Think of the client that really needs support but is waitlisted due to constraints within the system. And other sectors that can show up in lack of funding for basic provisions, inequities between newcomer groups. So if you think of asylum seekers or refugee claimants versus government assisted refugees, and some of the inequities of resources that might be there. And finally, let's look at burnout. So, burnout can impact a person emotionally, physically, mentally, and this is due to prolonged and often repeated stress. Burnout also brings with a sense of reduced accomplishment and a loss of identity or detachment from the work that you are doing. There are many causes of job burnout. I think lack of control, unclear job expectations, lack of supports in the workplace, poor boundaries, and difficulty establishing work life balance are a few of the causes. Also noted to be a helper or in the role of a helper or a health professional also increases the risk of burnout. I think, the next few slides you'll see, we'll move on to discuss and consider the impact of the cumulative effects with regards to, all the things we just talked about: vicarious trauma, moral distress, burnout, and compassion fatigue. So I'm going to hand it off to my co-presenter, Prasanna, now.
Thanks so much, Laura. So get you folks to bear with me till I get my slides up. All right, thanks so much, Laura. So so Laura talked about a few different concepts, I guess, that we'd like you to be aware of, especially if you weren't aware of some of those, that terminology. And the reason we are introducing some of the terminology is because those aren't really diagnostic criteria or diagnoses. If you were to seek support for yourself from a healthcare provider for your own needs, right? So whether it's from a physician, from a family physician, or even from a mental health and addictions support person. And so what's our intention is to make sure you folks know about these terms, especially if you haven't, so that when you do approach somebody to get support for yourselves, that you're able to use these terms so that hopefully it'll direct them to support you in a more targeted way. So in this slide, what we want to do is to talk about the idea of the cumulative work that Laura already alluded to. And so this work is We're drawing from the expertise of the Tend Academy, which is a Canadian company that's operating out of Kingston, Ontario. And what this graphic is showing is at the very top, it's talking about personal vulnerabilities. So here, what I'd like you to think about would be your own lived experience as a person before you're a care provider, right? Regardless of which sector you work in or what your specific profession is, and to acknowledge the fact that you're a human being first with your own needs before you start working with a specific demographic of clients. And then if we go to the right-hand side of the graphic there from personal vulnerabilities, it shows work-related traumatic grief or loss. So here, what these folks are talking about could be the grief and loss that you might experience from a client or a family member of a client passing away. But because we're talking about application to professional settings, I also wanted to think about grief and loss due to any disruption or rupture in relationships, even with your coworkers. So it could be a situation where you have a support network, of course, involving your loved ones and family members, but other than specific or formal supports from organizations that Laura mentioned, like occupational health and wellness or employee family assistance programs or similar versions of it, you may have a coworker or a peer that you're quite comfortable with seeking support from or even offering support to. And it could be a situation where that person retires, they switch jobs, so on and so forth. So from this bit of theory, that's what they're inviting us to do, is to think of not just people passing away, but also those disruptions to relationships you may have with each other as coworkers. Another way they apply this category is to also think about the loss of contact that you may have at times with your clients and families that you're supporting. And when that happens, it's for very good reasons, for reasons of confidentiality and for maintaining their personal information in confidence, especially if they are referred to another agency, or let's say they move out of province to a different province than you. Or it could be any number of different reasons. And here the invitation is to think about, so Laura talked about not really attachment to your families, but the fact that sometimes the work lingers neurologically or neurobiologically, because it is caring work. And at some level, your brain doesn't care that you're a professional and you're caring for the client, because the function of that relationship and caring is one and the same as if you were caring for somebody in your family or one of your own children or a relative. And so thinking about it from that lens is also not that it's always going to happen, is that there may be times when you may require a little bit of time to convince not yourself, but your brain that the family you are supporting or the client you are supporting will be okay, is okay, because you know that they were referred to another agency or a support, a different type of support. Just below that, it's talking about direct exposure. So Laura talked about indirect exposure and vicarious trauma, which is on the bottom right-hand side of this graphic, but just above that, it's talking about direct exposure. So here, I want you to think about interactions with your clients or interactions in the workplace where you were impacted as a person. Right? So for your staff, and so what I want you to think is, even though you may have a professional role during whatever the interaction is or the event is, that as a human being, you're directly impacted. So Laura talked about some of the work in emergency departments or some intensive or inpatient settings. But it doesn't have to be those type of, acute care settings where this can happen. This can happen anywhere, right? So it could happen in the community. If you provide care in the community, or you meet clients in the community. It could happen in outpatient settings, it could happen in group settings, or even associations or clubs, or it could be YMCAs. It doesn't really, the location doesn't matter, but what's important to know is that it is actually happening to you versus the vicarious trauma, which is the observation of the events that may not involve you directly, right? Or gaining knowledge, as Laura talked about, the experiences of your clients, or reading case history, or hearing from your client about what has happened to them versus what it could happen to you directly. And then from there, so if you continue to follow the graphical on the bottom here, on the bottom left, there is empathic strain and compassion fatigue that Laura talked about. Moral distress, so this diagram talks about in terms of systems failure. Laura talked about burnout and working conditions. And then the last term that this graphic has is titled social and cultural context, which is in the same vein as personal vulnerabilities, but the idea here is to get us to reflect on our own position in society, our own experience of power imbalances. And in the slide that Laura talked about, psychological safety, there's some information or a graphic alluding to microaggressions. Right? So for this final part, that's what I'll get you to reflect on is, what are your current experiences versus in personal vulnerabilities? We're inviting you to think about your past or lived experiences. And then the way the graphics laid out, the idea is to think about, there could be some situations where only one of these factors could be impacting you, or is even relevant to you, depending on who you are as a person. And there could be some others in this session or peers that you're working with where all of these things could be happening over a period of time. From here, what I want to do is to get us thinking about strategies, I guess, or things that we can do to protect ourselves, things we can do to, protect ourselves from experiencing stress and things like vicarious trauma, empathic strain, and burnout, even more than we might already be experiencing. And what the literature reflects here is, or suggests, is that it's not really the responsibility of any one person or one domain, if you will. So I've definitely been in some conversations or project work over the years where there's been some folks that feel like, right, it's absolutely the agency or the organization's responsibility to protect us because we are experiencing this stress or these stressors in the workplace. So there's truth to that. And what this slide is inviting us to think about is at the very bottom where it says personal, is to think about the fact that we can only control what we are able to do, right? It's the same as I'm sure some of the messaging you'd be giving your own clients and families that you support, which is, yep, there are so many things that should happen and must happen, and yet we should focus on what we can absolutely control, which happens at a personal level, right? So for ourselves, when we're thinking about strategies, what I'm going to invite you to do is to think of what already works for you when you feel stressed or when you're feeling overwhelmed, whether it's burnout or just the pace of the work, and then think about additional supports that you may have at an organizational level. And for the middle category, for professional, I want you to think about, depending on how big your organization is, I want you to think about strategies or supports available to everybody for specific professions. So it could be all occupational therapists, all settlement workers, all directors, if you want to think about as a peer group as well. Or you can also think about this middle category as a team, right? So, and for a team, there could be multiple different types of professionals. Yet the invitation then is to think of, right, so at a team level, what types of supports are in place and what types of supports might you want to advocate for. So that's just as a high level way to organize your supports and for yourself. From here, what I want to do is to just quickly go through some suggestions that's reflected in the literature and from folks like the Tend Academy. So we know that, depending on which agency you work for or what your funding streams are like or formulas are like, at an organizational level, there may not be a lot of support that are available to everyone in the organization. And yet, what has shown to work, regardless of how big the organization is to think about, support, right? So have formal support. So I mentioned occupational health and wellness services or employee family assistance services or assistance programs. But even if you work for a small company or organization and you don't have access to those services, is to even think about this idea of peer support service, which is a confidential avenue for people to seek support from each other at a professional level, right? So the idea here is that I can speak to, so for example, Laura, who also works at IWK Health, just to talk through some things, right? Not necessarily talk about my psychological needs or what I should do, but to get some sort of support from another like-minded person or somebody else who has the same lens or perspective as me because they work for the same organization. And then there's also lots of evidence that's out there talking about the importance of debriefing. And so when you see that word debriefing and hear the word debriefing, it may mean different things to different people. And in this context, what we're talking about is not just a debrief after a major event or an adverse event, but the opportunity for everybody to get together, regardless of which team you're on or what the profession is, and talk about how people are doing, versus just focusing on risk mitigation and prevention of further adverse events, right? So especially if you work in healthcare, we know that, you have to prevent patient injuries. And even if you're not in healthcare, that's a very, very important function, which is to prevent adverse events from happening if it has taken place. And so if you're already doing that, the invitation here is to add on that additional layer, which we are calling psychosocial support, which is to create time and space for people to actually engage with each other as human beings, aside from those what we're calling operational debriefs, which look at, right, what was the root cause of the adverse event, what was the outcome, and how can we prevent it in the future. And then other things, I mean, most organizations would have some of these supports, and some organizations may not, but, having a built-in mechanism for staff to request time off and then actually have the ability to take time off. So in the little picture to the top left, it says variety in caseload and tasks. So that's referring to, the function where you don't get, fatigued or experience empathic strain because you're doing the same work over and over. But when you're thinking about the idea of not having the ability to take time off, quite often that's because of increased workloads as well, right? Or the fact that the demand never ceases to, or doesn't ever cease, and then and yet we may only have a finite amount of resources. So they. That's a little different. Oh, here we go. Sorry about that, folks. So in the next category, so professional, remember I said it could be specific to your profession or as a team. So here you can think about clinical supervision groups or even professional supervision groups. And again, it's not really to problem solve or for the purpose of learning, which is different. So that's absolutely required. But when we're talking about support for yourself, it would be around consultation about decision making or checking in with people about how you feel or the fact that you are feeling a certain way about how a case is going or how a client is doing or not doing, and to seek support at a team level or within the collective understanding of a specific profession, rather than thinking about it at an individual level or at an organizational level. And here in this graphic, it's also talking about skills. So this could also be a function where, as a collective, you realize, oh, hold on, there are 3 of us talking about the same thing. So perhaps it's time for us to seek some additional training or explore some additional resources to support each other. And then we inserted this graphic in just to say, regardless of how, I guess, educated we are, or the fact that we know that care for ourselves is really, really important so that we can continue to do the excellent work that we're doing, that quite often, when you're doing caring work, you may ignore your personal needs. Right? So I can speak for myself, where there's been lots and lots of days, weeks, and sometimes long periods of time. And with that, I want you to think about what Laura talked about in terms of that idea of tolerable stress, where I was choosing to forego some of my breaks. I was choosing to stay back and do some extra documentation or extra work because I know the demand is so high. And what we know, well, I know for myself, but then when you're thinking about research and what's reflected in the literature, is that if people forego or minimize their own personal needs, then it's really not possible to sustain that level of work and effort, if you will. And so at that point, you yourself may get impacted, and if you're impacted, then the quality of your care that you are so vested in providing your clients and families may not be happening anyways, if you're unable to keep yourself safe and healthy. So for personal responses at the start, I talked about, there's so many strategies that I could talk about, which may or may not work for some of you. And yet, we know that, there are some strategies that do work for most humans, but because we're all individual and because we have our own lived experiences as well as current experiences and needs, what I want you to do is think of, reflecting on what works for you, and think of what works for you when you're at home or when you're not stressed. Or I also want you to think about things that you like to do that you enjoy, which also have a secondary function of helping you to feel regulated or actually make you regulated, either physically or emotionally. And if you can start with that list, then the next invitation would be to think about, right, how can we then start to use some of those strategies when we're at work? And then, there are certain strategies that, as I know, that do work for most people. So as you see here, mindfulness has been shown to work, mainly because we don't just have responsibilities at work. All of us have responsibilities outside of work, right? Even if you're not in a caregiving role, or I should say a serious caregiving role, we all have, responsibilities and commitments outside of work. So the idea behind at least trying some mindfulness activities or meditative activities is to try and center yourself so that regardless of where you are, you can stay present in the moment and try and make sure that you're not thinking about events or tasks that have taken place in the past. So it could be, I'm at home and I'm still thinking about it at work. Sorry, at home, or I'm at work and I'm thinking about what could be happening at home. So when you're thinking about that function, I've been a caregiver, professional caregiver for a number of decades, and it's really easy to say, but really, really difficult to do, right? So that's why we're even talking about this, so that, if you are finding that it is hard for you to separate those two domains, that, the hope here is that you'll take some time to think about what might work so that you are able to have a little bit of a separation. The next thing I want to talk about and introduce you folks to, just in case you haven't heard about this concept before, is the difference between self-soothing strategies versus self-care strategies. With self-soothing strategies, I want you to think about things that for sure work for you regardless of what you should do to provide support for yourself. right? So that's why it says quick relief. So for quick relief, I want to think about those situations or experiences where you might be experiencing the signs and symptoms of fight, flight, freeze, or it may not even be fight, flight, freeze, but that's the what the need is in your brain, where you need immediate sense of regulation or calmness, versus self-care, which is the knowledge and knowledge that we have, which is that there are certain things we should do on an ongoing basis to maintain good or healthy physical and psychological health. So an example I want to share is around food, because I love food, I love cooking, and I love eating it even more, is that I know under the self-care category that there are certain types of food or quantities of food that I should be consuming for my age and health needs. And yet there are some days, even in this role, where I just need to eat what I need to eat to make myself feel better, right? So that's the difference. Is I know what I should eat based on my recommendations from my healthcare providers. And yet, even though I have that knowledge for self-soothing, I'm still going to eat what I want to eat because I know that'll give me immediate relief. So I gave an example of eating, but the self-soothing activity could be anything. Could be a behavioral activity. It could be a spiritual activity. I want you to think of things that bring you immediate relief. And the invitation is not to stop doing them, because there's a very good reason why your brain likes it and gives you immediate relief. But to be aware of, I guess, or to reflect on whether you're only engaging in those self-soothing activities, right? So earlier on, Laura talked about some coping strategies that may not be healthy, like consuming alcohol, or it could also be engaging in some unsafe activities in the long term. But the idea is think of what it is and make a plan if you would like to make some changes or try something else. And in terms of other things that have shown to work, so mindfulness activities of any sort, it doesn't have to be meditation, have been shown to work. A couple of other strategies that I want to share would be any exercise that involves breathing, because as human beings we have to breathe anyways. And this activity, some of you may know it as box breathing, and some of you may know it as maybe called something else. 4-count breathing, 4-step breathing. There's multiple different ways to describe this. But the idea here is, depending on what's happening around you or what your specific needs are, is to count to 4 as you're breathing in, count to 4 before you breathe out, and then as you're breathing out, to count to 4 as well. So I know I said count, so when I do this for myself, sometimes I count in my head, and sometimes I actually touch my finger, so I go, which gives a secondary gain, which is to connect my brain to think about not just controlling the breath, but paying attention to the physical touch when my fingers touch each other. And in the next strategy here, I mean, we're just sharing these as 2 possible things you could try. His activity is called the 5 senses activity. And here you can just think about, what things you can see, things you can touch, things you can taste, smell, and hear. Or you can also think about numbering these, right? So the order of the senses doesn't matter, the number doesn't matter, but the activity that we sometimes lead people through could be to look at one thing that you can see. Think about 2 things that you can touch. Think about 3 things that you could taste. Think about 4 things you can smell, and think about 5 things you can hear. So the reason I said the order doesn't matter and the number you assign to it doesn't matter is depending on where you are. So for example, if you're in an office setting and there aren't a lot of noises, you may not want to challenge yourself by trying to listen to 5 things. But depending on the environment, you can absolutely change the number and the order as well. And I know this works for me personally, and a lot of folks have said that this is a really good way to ground yourself or themselves, even as you're still engaged in a work task at work. In the last session with Laura and Holly, they talked about the idea of cultural, racial, and ethnic characteristics of resilience and resilience in general. So even though I talked about some strategies to consider, I also want you to think about your own resiliency factors, right? So as adults and before you're professional caregivers, as adults, you have your own resiliency factors where that you've used so far to stay alive in the world and to get through the world, and then now to function as a care provider. So the invitation is not to forget about those things as well. And then here, I know with this slide, it's talking about cultural, racial, and ethnic characteristics, but I also want you to think about your family values, right? So things that are important for your family unit, things that are important to your family of origin, so on and so forth, that may be of help in certain moments as well. And then I talked about this a little bit already, but the idea behind this graphic is to get us thinking about things that you can control, especially if you are thinking about making a change. So let's say from a self-soothing activity that you might be realizing you're doing, not just when you need to self-soothe, but in general, and you want to try something else, is to think about starting with strategies that you can control versus things that you may not be able to control. So here, some things to consider could be your living circumstances. Or do you live on your own? Do you live with other people? Do you live in an apartment? Do you live in a space where there's open space or easy access to nature? So on and so forth. And take all of those things into consideration, so that if you make a decision to try something new in terms of self-care or self-soothing activities, that the change or that your choice to try something new isn't getting experienced as an additional stressor in your brain. From there, there's another general strategy as well that we offer folks, again, coming from the TEND Academy, is to chunk up your work into different subcategories. You can think of this where it says before, during, after as before work, during work, or after work. Or if you have a particularly challenging day, or it could be a challenging day, is to think about strategies that you can use to regulate yourself before you go into a meeting. For example, things you can do during a meeting to regulate yourself, and things you can do after the meeting to continue to try and support yourself. And then this is another tool that's offered by the TEND Academy. So this is talking about the idea of low impact debriefing. So I talked about the idea of debriefing, which is the risk mitigation and prevention of adverse events versus the psychosocial aspect of it. So this is specifically focused on the psychosocial aspect of it, where the invitation isn't to go and seek support without asking permission from people, but to give the person that you're going to check in with fair warning, as it's saying, to see if they are free to support you. And when you do check in with them, and if they say yes, they do have some time, is to make sure that you let them know exactly what you're looking for. So whether it's a solution, or if you just need them to hear you out, and then you just need to vent things out. And then a few slides ago, I talked about that idea of before, during, and after. So depending on how you decide to use that framework, you can also think about the after being your transition home from your workspace. So whether it's a 2-minute walk, a bike ride, a bus ride, a car drive, doesn't matter, but to think about any opportunities that you may have to engage in some regulating activities for yourself before you actually switch gears and start to engage with people in your personal lives. So I know I'm getting we're a little bit over time here, so we'll wrap things up here. But the overall goal, I guess, for this session anyways, or a part of the webinar series, is to continue to do our job well while staying well, right? Without compromising our own physical and psychological safety. So what we're going to be doing next is what we did last time as well, which is to now apply the principles. So I talked about strategies, but as a general tool to apply the principles of trauma-informed care. Molly, do you want to?
Yeah, thank you, Prasanna and Laura, for helping us to go through the principles of trauma-informed care and thinking about staff wellness and, going over the terms of things that might occur, because we can be working in workplaces that do cause stress and do have different experiences related to trauma. So what we're going to do, similar to last time that we were together, is we're going to go into 5 groups looking at these 5 principles. So we're going to have a group looking at safety, a group looking at trustworthiness, a group looking at choice, collaboration, and empowerment. And we're going to be in those groups, myself, Prasanna, and Laura. And also joining us is Kat and Colleen. So we'll be in those groups as well to help you just to navigate if you have any questions or anything. And what we would like to do within those groups, we'll be randomly putting everyone into a group, is if you can at the beginning, decide who is going to record kind of the conversation that you have and who's going to report back. And what we're going to do is look at those principles and think of, what are we doing now that is working really well? So what do we do now for staff safety, for instance? What are we doing well to promote staff physical safety, psychological safety, cultural safety in our workplaces? And then what can we be doing to improve that into the future? So there's some things that we can think we can improve upon. And the idea is that we can do this in our smaller groups. And then we'll come back after 10 minutes and share kind of our thoughts and findings with the larger groups. So that way, hopefully we can all benefit from the richness of the conversations that we're going to have. So Mariah is going to help put us in those groups. So back. Thanks, Mariah. Welcome back, everyone. Thank you so much for participating in your groups. I know my group had a really great discussion about many different things, topic and untopic related, but very valuable. So my group was group 1. So we'll start with our group. And Diana was very gracious to listen to us and to take some notes within our group. So Diana, if you're able to share those. And it was looking at safety and the concept of safety, what we're doing currently, and then what we could be doing in the future and everything else in between. Thank you.
Yeah, our group started off by thinking client versus yourself, to be introspective and actually focus on ourselves is a change, since we're always focusing on our clients. So that's where we started off. And some concerns that came up were the systematic support for ourselves. Where do you start with that? Or how to create that safe space to talk, since a lot of our systems and agencies are being overwhelmed with employment issues, lack of staff, or everything that's coming along right now with COVID. And an interesting point was that COVID did bring to light these struggles, but it didn't create it, but we are in the struggle. So with the systems, there's large staff to check in with, an acknowledgement of what we need, not enough in person. So it's trying to go over those barriers in order to get that need for an increase in relationship, in order to feel safe to express our needs. And I think that's where the meat of our conversation was at. And of course, we also talked about practical things like debriefing or psych support or stress training, and how that would help and how that has helped in the past. But I think overall, it's just trying to get back to relationship and checking in with one another, that we're not alone in all of this, and that helps.
Thank you, Diana. That captured it beautifully. So our next group is looking at trustworthiness.
Hey, Holly. So speaking of busy lives, our group had individuals with some competing demands. So I said I'll take some notes. So things that the group talked about in terms of things going well or in place to create trust and maintain trust is have an understanding of being open to any and all ideas. So not even the expectation, we're not going to make fun of you, but to welcome ideas regardless of how silly they may seem to the person, and for the recipients or the people listening is to accept all ideas as good ideas and explore options. And then valuing the experience of teammates. So whether it's professional experience, academic experience, and I think the person who shared this was also talking about their own lived experience that adds to their role, right? So thinking about all the different things that people bring to a team, and then prioritizing confidentiality even amongst team members when it comes to talking about caseloads. So even though there may be a common understanding of, right, so I have these 3 clients, is that this person talked about being really or that the fact that it's really important to maintain confidentiality even within a team, which builds trust amongst the workforce. And in terms of areas for improvement or things to consider, was to be really mindful of not forwarding group emails, especially if there's a leadership element involved there. And if that needs to happen, is to get specific permission from the person first, or the other suggestion was to cut and paste the relevant information versus, so let's say I'm the one that sent the email, so that the rest of the team knows, oh, Prasanna said this or feels this way. And then there was also a suggestion about, especially with this work, that sometimes could be multiple funding streams or people involved. And if that is the case, especially for the client, but then even for ourselves, to streamline the communication so that people aren't getting multiple emails about the same thing, which could cause whether the client or us to feel like, well, a sense of mistrust, because it might feel like, do people actually know what they're doing? Because I'm getting 2 or 3 emails about the same thing. And then another thing was to be hyper aware of transparency and flow of communication, especially from leadership, and with each other as well, so that if the communication pathway isn't clear or there isn't enough communication from leadership, that rumors start to happen or miscommunication might start to get spread in the absence of clear communication. And then the last item was around being clear with each other and with clients if we are unable to meet and meet, right? So set clear boundaries, which may not be pleasant, but make sure that people know if we're able to do something or not, which again creates a sense of trust.
Perfect. Thanks, Prasanna, to you and your group for all the great suggestions. They're really good. Our next group is looking at choice.
Yeah, so I'll kind of be the spokesperson for the group. So we did look at the aspect of choice and what choice we have within our roles, as well as kind of what choice would we like to have, or some of the things that we would like to be different in terms of increased choice. So with looking at the first question, some of the things that came up would be especially around the choice to either work from home or work from the office. And so recognizing that, based on different work locations, some people were offered that choice and were offered, to kind of either have a hybrid model or work primarily from home or from the office. So that was seen as a kind of having that choice there. Some other choices that, kind of existed, people being able to kind of create their own schedule in a way that works for them in terms of being able to book their own clients versus having kind of a system where clients are booked into your schedule and you don't have a lot of choices to how and when they show up and when they would be booked. So those were some of the things that kind of came up around the choices that kind of exist and kind of are offered. And then some of the conversation about, what what would you like to see different or be different to offer you more choice or to have more choice? You know, talking about, again, you know, that home office versus, you know, work office, and really finding it difficult if you're not given the choice around where you work, especially for that work-life balance, that it's really difficult to have that separation and to kind of keep balanced when you're kind of forced to work in your home space and you don't have much choice. So I think that would have liked to be different. Things around, you know, if you are in a position where you are in leadership or administration, and often you don't have the choice to kind of turn off your email or turn off your responses, you're kind of on call, and you know how that impacts your ability to just kind of step away from the work or shut down or recoup when you're constantly maybe bombarded by emails or discussions that you need to respond to. And I think there's a mention, and I can't remember, but like a country that, you know, actually makes it a requirement, or it's a, you know, you shouldn't answer any emails after work hours. So it's like you're not allowed. So we all thought that was maybe a positive thing. And then talking about, again, wishing that there's maybe more opportunity to have choice around that workspace. So recognizing if I function in a way that's more efficient and able to get my work done really well, you know, having my own office versus maybe sharing a workspace where there's interruptions, conversations, and it's just difficult to maybe have the same opportunities to get to the work. So wishing that there is a bit more choice around that. So I think I captured or tried to capture at least what we talked about. So that was kind of our discussion around choice.
Perfect. Thanks, Laura, and to your group. And I love the concept of that email where you don't send emails after a certain time. I know that's something we have to have conversations about, and just, yeah, how we all kind of model that, right? Are we all kind of sending emails at, you know, late hours of the night, and how do we kind of model that? Or one suggestion that somebody had was, and it was a valid point, that they said, you know, with my schedule, the way it's working, you know, the time that my kids are in bed and that I'm able to send this at this time is later, but they actually now have set a timer, I guess. So then they'll send it kind of first thing in the morning, so it's delayed to get it sent, or those kind of things. So yeah, trying to figure out how to balance our home and work life and ways to do that, or just saying, hey, I'm sending this email late, but you don't have to respond, all those kind of things. Yeah, great. Thank you. So our next group is looking at collaboration.
Hey everyone, I'll be quick talking about kind of what's in place. We talked about monthly meetings, both within a team and cross-sectorally in an organization. That can be helpful for collaboration. Similarly, well, we talked more about challenges, to be honest, that could kind of segued into challenges. We talked about how in some organizations, collaboration, people can feel a little time poor, like in the academic sector, it's not always reimbursed, like they're not paid for that. So that can be challenging. And working online has kind of presented some flexibility with that, but also some challenges because you don't have those impromptu bumping into someone in the hall, like you need to kind of set up a Zoom or something. We also talked a lot in terms of what could be done differently, and challenges about role clarity and that being really important. So having designated people or teams working on specific things, and similarly not working in silos, which can obviously be a challenge, especially big organizations like big hospitals or big universities. There's some desire expressed for increased transparency of different projects in a big organization, so folks can collaborate and support that kind of work. And that's made easier when there are institutional relationships, which also kind of relates to role clarity. And just, you know, not that there's frustration and it's kind of a downer for morale, if not knowing if teams are working on the same thing or having the same conversations. So it's kind of a bigger picture thing to know what everyone's working on. So yeah, great discussion.
Perfect, thank you. Yeah, I mean, I think a lot of organizations, big and small, have those difficulties of how do we communicate, because there's often a lot of great things, like you said, projects or things that are happening, we don't always know. And it creates kind of rework, and, you know, if we can strengthen those relationships and connections and collaborate together and partner, you know, how much better, rich, and diverse would the, you know, the outcome be. So great, thank you. So our last group is empowerment.
Hi, I'm Monica, and I'm going to just share what we talked about. We had a small group and a good discussion. So we talked about what's in place now to empower you. A couple of things came up, professional development opportunities, and being part of an agency that really values them and supports people to take professional development opportunities, and how it really encourages us to feel empowered to stretch ourselves and to learn more about these things. And then also sharing opportunities. So you know, the importance of high quality interaction with peers and colleagues, and how, you know, if colleagues value and are curious about what, you know, they can share together, it makes us want to share more of ourselves and be more engaged with the team and seek out resources and all that kind of thing. And then a couple of things that we talked about maybe doing differently would be to offer more programming, like more programs that are professional development, but that are actually based on trauma integration and awareness. And that would empower us to develop courage and compassion and a really centered feeling. And then one small thing would be to maybe create some kind of a tool. Wouldn't it be nice if we had some tool that would support us to have something like, you know, a well-crafted empowerment phrase that we can use when we need to pull it out and we don't have to create it on the fly, and, you know, something that we can refer to support ourselves when we need to reach out or ask for that supportive debriefing or whatever other kind of supports we need. And that's about it. Thanks.
Thanks, Monica, and to your group. That's a great idea. Yeah, to have that tool and kind of empowerment phrase. I really love that. Yeah, that's great. So thank you to all the groups and for all your discussion and input and great kind of ideas of what you're already doing and what you could be doing in the future. And we hope you kind of, again, continue this conversation about the staff piece of it with your teams and kind of thinking about, again, how do you support one another, do the great work that you're doing? And we want to take the opportunity to thank you for all the great work that you're doing. We know many of you and all of you are in, you know, these caring professional roles that are supporting people. And we thank you for doing that great work every day. And we hope that this can help support you to, you know, do your job well while staying well, because we know you're already doing the job well, but we want you also to stay well. So I'm going to pass it over to Mariah to kind of close us out, but we will be having our PowerPoints available to you too, and our contacts for you to get in touch with us as well. So please feel free over the next bit to do that and for our next session.
Yeah, thanks so much, Laura, Holly, and Prasanna. This was another great session. I know I really enjoyed hearing all the practical ways that the trauma-informed care principles can be put into practice. Sounds like there were some really great discussions. So we will be, by the end of the week, we do hope to have a recorded version of this session uploaded to our e-learning side of our platform, and we'll share that with all those who have registered for the session. We also will be having the next session on December 8th from 1 to 2:30 Eastern Time, and that will be focusing on trauma-informed care considerations for organizations and systems. So we hope to see you all back here for that. And then as always, we always do surveys for quality improvement. So following today's sessions, you will be invited to complete our short survey to share your feedback with N4 and also the IWK team. And these surveys will help us improve and continue to improve the next session. So that should pop up in your browser as you leave today. And with that said, I just want to thank all of you for joining again. We look forward to seeing you next week. And if you have any questions, please feel free to follow up with anyone on the IWK team or Andrea and I. Thanks, everyone.